Doctors Manitoba, Dr. David Cram joins me, medical doctor and board member at Doctors Manitoba. Dr. Cram, thanks a lot for joining us here on CTV News Channel.
Thanks for having me, and thank you for your interest in rural healthcare.
It is indeed, and you know what, this is not, I can say, I don't think it's a new story. It's one a lot of doctors have been talking about and warning about. What is the situation like in your ER right now?
Well, unfortunately, the strain of the chronic shortages in Canada and Manitoba, especially in rural areas, for quite some time, and the healthcare system's slowly been crumbling. And then COVID came along and just crushed us. And I've been a country doc for a long time, and it's been a real privilege. But I've never been as concerned as I am now. What you have to understand, in a small town, what happens is the doctors with the nurses are running the hospital and the emergency department. So with the chronic shortages that we have, if you have one doctor that, say, relocates to the city, as occurred here, or if you have one doctor, sadly, that got ill, or someone takes a desperately needed vacation, you're just short of docs, and you literally have to shut down because there's only so many of us. And there's some places are so short, they're one nursing shift away from having to close. Now, this is where people go for their care. This is where my neighbor with the obstructed kidney comes to emergency, or my other neighbor comes when he has his heart attack, or my kids come after they've dislocated their shoulder at the football practice, you know.
Right.
And it's just such an important thing to be able to provide, but it's sad, but we just have to close down sometimes. And I've been asked, you know, what kind of effect does it have on the community? And I would sort of just reflect back what it would be like if Toronto General closed for a day.
My goodness. And we're seeing, you know, all of this, the backlogs and whatnot, really in many provinces right across the country. Healthcare is at a critical stage once again. I think it continues to be so. Why are the supports not there? It's constantly on the docket at all levels of government here, yet these conversations and the concerns that you've just outlined are still there.
These are long-standing, deteriorating, complex problems, and there's no easy solution. But I think we have to start with the federal government, and we have to look at transfer payments. I think they need to increase. I think we need to have a national health human resource plan. You know, how many doctors do we need? Where do we need them? It's sort of ludicrous that we don't have one, and I know the Canadian Medical Association's meeting with government to try and create that. I think there has to be cooperation with the provincial governments, with their provincial medical associations, to work together to try and solve these complex, challenging problems. But it's tough. It really is right now.
How are you doing? How's your staff holding up? Because I'm sure the pandemic itself has just made things so difficult, and now you're still having to deal with the stress.
Everybody's burnt out, absolutely everybody. And, you know, and hats off to all the healthcare workers that have done so much, whether it's in the country or the city or wherever. You know, everybody's working so darn hard, and everybody's pretty much at their breaking point. But I think it just reflects a dedication. You know, it's in our blood. This is what I do, and I'll continue to do it as long as I can. But it's just getting harder and harder and harder, I'm afraid.
Yeah, unfortunately, and we always appreciate and know what incredible work you and the teams and the doctors right across the country do. Dr. Cram, thank you so much for giving me your time. I know you're working today. I wish you a good work day and hopefully a low-stress one. Thank you for speaking with me.